This is the recorded lecture over clinical decision making. The NCLEX RN test plan will test on knowledge, comprehension, application, and analysis. But most of the questions test at the levels of application, analysis, and above. This is why it's so important that we are able to think critically. Critical thinking defined. So, what is critical thinking? It is a complex way of thinking that takes a higher level of thinking that requires one to personalize, analyze, decide what information means before making judgments, examining consequences, and applying logical justification for actions. So, what is the difference between critical thinking and thinking? Thinking can be any mental activity. It can be mindless. Thinking, what am I going to have for lunch today? Where's the dog sleeping? We have an increased need for critical thinking due to healthcare reform, changes in the healthcare industry, which are continuous, rapid technological changes, and higher patient acuity. Critical thinking versus feeling. The critical thinking is deliberate and regulated. Um, we're using well thought out methods to achieve desired outcomes. Feelings can be disguised as thinking based on past experiences, biases, and personal worldview. So the nurse must set aside personal beliefs and background assumptions based on culture and personal history to solve problems in an unbiased way. Problem solving is the goal, but we need a broader view of critical thinking. Looking for current research and best practice, for instance, is using critical thinking. We're looking for the best practice to manage the patient's pain for a specific health problem. We use critical thinking in nursing constantly. We're always striving to improve patient outcomes by deciding what the outcome is, what is the best way to achieve the outcome, what are the patient's problems. Ultimately, we want patient satisfaction with positive outcomes, but it's going to take critical thinking to make all of that possible. So we've got critical thinking and creative thinking. So creative thinking involves, generating new ideas, new approaches, new solutions to problems. application of plans to new settings and new cultures. Critical thinking and creative thinking are somewhat similar, but creative thinking focuses more on creating new and original ways of thinking about information. Thinking outside what is normally done or thinking outside the box can result in new approaches to client care. Critical thinking in nursing. Nurses move from novice to expert in critical thinking. Someone who is just getting ready to graduate a nursing program. They would be at the novice level of critical thinking. Nurses who become skilled at recognizing cues and themes in patients, reflect on those patterns, think critically, and use clinical judgment. They provide a more highly skilled clinical practice. Nursing judgment encompasses critical thinking. Which means we've got critical thinking, clinical judgment, and integration of best evidence, which all of these things are interconnected. Critical thinking, problem solving, and the nursing process. Using the clinical judgment measurement model from the National Council of State Boards of Nursing, which is a science-based problem-solving model. It requires critical, creative, reflective thinking. Step 1 is recognizing cues. This is a specific response or absence of a response. Here we're going to gather all information that is needed. Step 2, analyze cues. Finding out what the primary problem is by analyzing all the patient data. So all that information we got in step 1, we're analyzing it in step 2. Step 3, prioritize hypothesis based on the problem, looking at the benefits, consequences, risk, and then rank them according to the patient's needs. So an actual problem is going to take higher priority than a risk. Step 4, generate solutions by making a decision and then identifying interventions based on the patient's greatest need. And then step 5, take action by implementing the identified interventions to save the patient. And then step 6, evaluate outcomes after implementing the intervention to see what the outcomes were. and determine the effectiveness of the interventions. Here we can make adjustments where needed, maybe implement more appropriate interventions, or continue with the current plan. Clinical reasoning focuses on skills essential for effective problem solving and decision making. Intuition is not really using intuition. It's being able to identify cues in patient care after being an experienced nurse after a couple of decades. You've just seen a lot and you're able to recognize cues easily. Clinical judgment is the outcome or the result of critical thinking and clinical reasoning. And it's the application of critical thinking to the clinical situation. Become experts in your field. You must understand the meaning of a word before you can move on to any type of analysis. You must know what is normal, what is abnormal. Know your pathophysiology. What are the facts with the clinical situation? Investigating the labs, assessment findings. All of this will help to determine the priorities. What needs done now and what can wait. And placing patient care above all else. Remember the importance of caring and building that trusting relationship with your patient. Critical thinking and holistic nursing. So we're talking about a holistic approach with all the dimensions of human well-being. So starting off with the body, maintaining physical health with diet, exercise, medications, over-the-counter or prescription, supporting mental health, supporting mental health with mindfulness, meditation, journaling, counseling, medication. Emotionally, are they emotionally stable, which can be affected by pain, their cognition. What's their spirituality? This is going to vary with each person. It may include religious beliefs or meditation. Having healthy relationships with significant other, not having an abusive relationship. Identifying and implementing cultural beliefs. What's their support system? What's their energy level like? And also environmental. Clinical judgment and accountability. So as the RN, you will be held accountable for all decisions you make in patient care. Whether it be, using your evidence-based nursing interventions, or delegating. So it's necessary to develop critical thinking skills to be able to make sound clinical decisions. Managing time. Do you have a time management problem? Well, the first thing you want to do is take a self-assessment of how well you are getting things done. Are you feeling overwhelmed or frustrated? As you progress into the RN role and have an increase in clinical decision making and responsibilities, good time management must be in place. First, plan your day. Expect interruptions and disruptions to your plan because that's always going to happen. But figure out a plan of what you're going to do. While planning, you're also going to prioritize. You've got your patient list. Okay, who am I going to see first, second, third, etc., according to their needs. Now get organized and prepare what you need before going into the room. Delegate as needed, which will help with time management. As the RN, you'll be collaborating with other healthcare professionals to ensure that patient care is coordinated. You'll be using critical thinking to identify problems and make decisions. You'll need to be able to organize and manage your time. Efficient and effective use of time. So take advantage of your energy. Know when you're the most productive. Are you a morning person and that's the best part of your day? Are you a night owl? 11 p.m. on, you have the most energy. Know when you need to ask for assistance and do so. And know when you can provide assistance and help someone else. Identifying time wasters. Now this is huge with managing time. Like I mentioned, interruptions, they're going to happen. Now, they happen, make adjustments, and move on. Socializing is wonderful in the workplace. We all have friends. A short conversation, okay, that's good. But catch up with that lengthy personal story on a lunch break. Giving or receiving a poor handoff report can wreak havoc at the start of a shift. You just have to manage, adjust, ask for help if things become chaotic. Personal disorganization is going to be a time waster. Get yourself organized. It's a must again. Plan and prioritize. Procrastination, do it sooner rather than later. You never know what may come up and then you get delayed. Being a perfectionist. Doing things by the book is the best way, but don't look for perfection. Be safe and competent in your practice. And learning to say no. If you don't have time to do something, you don't have time to help, you have to say so.